Welcome to Open Classroom, the Brown School's digital forum for community and conversation. My name is Sarah Sims. I am new to the Brown School. I am the manager of continuing education here. And thank you all for joining us today for this program. I'm joined with a few people. I want to give a quick shout out to my co-host and facilitator for today, Cynthia Williams, who is the Assistant Dean for Community Programs, Community Partnerships here at the Brown School. She will be moderating the Q&A portion of today's program at the end. So speaking of Q&A, I want to get started with just a few housekeeping items. First, this is a Zoom webinar format, which means that we can't see you, we can't hear you, but we still really want to engage with you via the chat. So we welcome your comments and questions throughout. And then, as I said, Cynthia will field those questions to Dr. Newland at the end. We are also live streaming on YouTube. A link to that will be dropped in the chat momentarily. However, we aren't able to moderate the Q&A on YouTube. So just so you're all aware. So now for today's program. Today, we're excited to kick off our 2023 Black History Month series. First, I really want to thank the Brown School's Black History Month committee who put together this year's programming, as well as all of the resources on the website. In particular, I want to thank and acknowledge Cynthia Williams, as well as Amber Brown, who are for their incredible leadership as the co-chairs of that committee. This year, the Black History Month theme is resistance against oppression. From the nation's first Black-led civil rights protest in 1819 to the Dred and Harriet Scott decision in 1857, and to Ferguson in 2014, St. Louis has led the nation in resistance against oppression. And that resistance continues as the next generation takes the reins of history. I invite everyone to visit our Black History Month webpage, which we'll drop in the link or drop a link to that in the chat. There you can learn more about our upcoming Black History Month open classroom programs. We have 4 more of them after this one, as well as some of the champions that we're celebrating on the webpage. So speaking of those champions, one of them is with us today as our speaker, Dr. Jason Newland. Jason is a professor of pediatrics at Washington University in St. Louis, and he is the Schnook Family Endowed Chair in Pediatric Infectious Diseases at St. Louis Children's Hospital. During the COVID-19 pandemic, Jason helped to lead an incredible interprofessional team in conducting research evaluating the rate of transmission in schools and the impact of routine school-based COVID testing here in North St. Louis County schools. Additionally, he has led efforts in studying the effectiveness and safety of COVID-19 vaccines for children and in interventions to increase the uptake of those vaccines. When not talking about infectious diseases or speaking on the benefits of the COVID-19 vaccine, Jason likes to spend time with his family and tries to get his 3 children to think that he's somewhat cool. A challenge that, for anyone who is a parent or caregiver, I'm sure can empathize with. So please join me in welcoming Dr. Jason Newland, who is here to discuss the COVID-19 pandemic and its impact on our school communities. Take it away, Jason.
Great. Thank you, Sarah. I really appreciate this opportunity. Okay. This is an incredible honor, and I mean that so much. And I thank you, Ms. Cynthia Williams, who I will speak a lot about here. And as a person who has obviously, by the look of me, has grown up with significant privilege, a son of my dad was a physician, my mother was a nurse. I grew up in a small town in Oklahoma where I was that person that was the smart one, the one that was going to be the doctor. And it means a lot now to say I know that I was privileged, and I understand that, and that the systemic racism that was present where I grew up and where I am now in regards to school has had profound impact on many people's lives, including those dear friends that I always thought had the same opportunity, but didn't. And I think COVID-19 has shown that, and in that has demonstrated to me and others how it has divided us in many ways, but also shown the disparity and how that disparity unfortunately continues to grow. And so I'm hoping today to tell you stories about an amazing group of people. I'm the lucky one that gets to talk about them. And there's a lot of them. And for those who if I forget you, I didn't mean to, because so many made this work possible. I have a number of disclosures just from our work. We were really blessed to get some funding from the National Institutes of Health, a lot of great people there to provide the funds, to get the funds out quickly so that we could do our best to get children safely and staff in school. State of Missouri helped us. Then we also did some work around the vaccines funded by Pfizer, Moderna, and then I have some antibiotic work. This is one of my favorite pictures. This is my youngest daughter, Anna. This is, I think, December of 2020. She was playing basketball. Couldn't believe it, but she had a mask. You see in the background, the cheerleader has a mask. It meant a lot that she was able to do some of these things. And unfortunately, not everybody had that opportunity. And what can we learn for any future pandemic? Though I'll say, I hope I'm not here for that future pandemic. This was tough, but we definitely have learned. So what I want to first do is step back. Think about 3 years ago. Where were you? What were you doing? 3 years ago, January 25th, 2020, we were just beginning to hear more and more about this virus that was circulating in China, and China all of a sudden was shutting things down. And it was labeled COVID-19. But when it really got real for us was on March 11th, 2020. If you're a basketball fan, I'm a diehard sports fan. I love sports. As you can see, I already have 2 basketball images. This is Rudy Gobert, center for the Utah Jazz. And right before start of the NBA game against the Oklahoma City Thunder from Oklahoma, they stopped the game. Actually, they were about to start the game, emptied the arena. Rudy Gobert became the first person, or first notable person, I would say, in the United States that was positive. We'd already had the outbreak up in Seattle, Washington, the nursing home, but this was what really stopped the country, was obviously one of our favorite pastimes, which is sports or athletics. A lot of things followed. And I will say that I was in this moment about to go on spring break. And by the way, I was excited about getting to watch the NCAA basketball tournament the following week. And here are my 3 kids again. These 2 wonderful young women on the side here are Ilsa, my older daughter, who's now a 19-year-old freshman in college, and my younger daughter, Anna. We actually headed to Florida for a beach vacation with some friends. And this is my son, Will, who at the time was a senior in high school, about to celebrate one of those exciting times in your life. And we kind of all went on our trips. I left kind of on that March 14th day and get down to Florida, and lo and behold, things really start happening fast. And these 2 wonderful young women on Tuesday, when I said, guys, we got to go back home, because if I don't get home, I might get quarantined and I have to be on call the next week. And what we know then is that school was out and school didn't go back after spring break. And as a matter of fact, in Missouri, they canceled in-person learning on April 9th. And I believe Illinois was either right before or right after that. School was shut down, and now people and all those school administrators out there who are listening and went through this, we're trying to figure out, how do we educate? What are we doing now? And those who had were able to flip over, and those who had not were trying to figure out how can we get those things, and those things being electronic devices and the internet. And you can imagine, if you're one of the marginalized communities because of systemic racism, like in North County, that we know that some of this might have been a true problem. If you're a frontline worker and you're trying and you have to somehow be home for your 8-year-old who's supposed to be online and you've never done online learning, how do you do that? Now, this next image, I don't necessarily like to show, but those out there who might know me more from this time of my life, which was, yes, there's also a previous look, by the way, as you can see. I became a spokesperson for the community. I won't go into the story. It's a great story that we can talk about later, but I became one of the people on KSDK and spoke every Thursday and Sunday. Mike Bush, a wonderful man, we would get on about 6:30. He'd provide me some questions and I would answer those questions for our community. My kids will tell you I said the same thing every time: distance, wash your hands, wear a mask, don't go out if you're sick. And yeah, it's pretty much what I said, and I could take almost any question and turn it that way. But it was a big responsibility, and I could feel it, right? I knew that I had to stay and be the right balanced voice that didn't lead to fear, but led to practicalness so that we could be protected. Now, as we all know, not everybody could be protected the same. And it became clear, and this is a slide that I presented on April 10th, 2020. It became clear at that point in time that our Black, African-American friends, families, colleagues, community members were suffering a lot more. And not only was Black, but also brown people, Hispanic, others in marginalized communities were taking the brunt of COVID-19. And you could see this. Chicago, Black residents dying at rate 6 times more. This is early, right? This is months in. Louisiana, DC, Milwaukee. If you look at pediatric cases in New York City, mostly Black and Hispanic. I'm a pediatric infectious disease doctor. This hit hard. I was a spokesperson for the city. Race is a social construct, right? It's not because you're Black now you're dying because of COVID-19 and there was something about you. No, you had been put in a place. Our Black friends, our brown friends were put in a place. And that obviously poverty, other social determinants of health had put them at great risk. I had to speak to that. I had to make sure we address that. And thankfully, a woman named Lorna Godwin, who maybe many of you know, a wonderful community member in St. Louis, well known for her work in media, regional response team, she sat down and helped me. She helped me be better to talk on the news so that I gave the clear, concise comments and that we actually constructed the question and the answer to why Black individuals in our community were suffering more, not only being hospitalized more, but dying more. So that was 3 years ago, or now almost 3 years ago, which is crazy to think. It seems a lifetime ago. But what is it like now? Well, so I pulled this yesterday, 12:21 p.m., January 24th. You can look at this every day. And I probably look at this. I used to look at this so many times and look at our states and look at our, our hospitalizations. I still look at our hospitalizations in the BJC healthcare systems that I'm privileged to be a part of. And I just, we can orient you, right? If we just go to the United States in the past 28 days, we've had 1 million cases. Now, we all know that's an underestimate. There's tons of people that are getting home tests. There's others who are running nose and cough at this time that likely might have it but aren't tested. I think the number to look at is the one next to it. The number of deaths is this white number. This is in the US, 13,000 deaths still every month or every 28 days. It's pretty remarkable that the total cases, over 669 million. And thankfully we can look at the vaccine numbers. But this virus is here, it is with us, and it isn't going anywhere. We have to come to understanding of that. And we won't go into that piece of it, but that's where we are now. And as I talked before, and I think we have to, as we're talking about, resistance to oppression and resistance against oppression for Black History Month, we still have to resist what this pandemic is doing to our people of color. So this is a figure that's on the CDC website. I find it a fantastic figure, and I'll walk you through it. So on the left, you're going to have kind of what the bars mean if you're above this center line of 0, which essentially means that the death for your group, for your ethnic group, is greater than your percent of the population that you make up of. So if you're above, that's bad, right? That's disproportionately high. And it hasn't changed from the beginning of the pandemic, right? So Hispanic here on the left, the different age groups, non-Hispanic, Black. And I want you to look at the scale because I'm going to show you Missouri and Illinois. The scale is up to 15% more. And then the white population, non-Hispanic, and then the Asians have been less proportionate in regards to death. This doesn't get into the comorbidity, the morbidity, the other factors, but this matters. And if we look at just children, as a pediatric infectious disease doctor, I have to talk about children. You do see that it's also present there. Now it's 0 to 24, but if we broke it down to 0 to 17, 42% of the deaths are in white, 29% in Black, non-Hispanic, 29% Hispanic. The disparity is still there. Now that's just one. That's on the health outcome. And I'm here to talk to you about school. And we'll talk about that. But if we look at Missouri and Illinois, it's the same story. So we have work to do. We have work to do in healthcare disparity. And this continues to be one of those things that we will be living with. And what are we going to do to address that more and more? Now, I would argue that the greatest impact of COVID-19, though over 1,500 deaths in a 3-year span from a virus is a lot for children. Don't underestimate that. But probably one of the biggest impacts has been on the educational achievement of our young people, the future of our society. And I don't think we paid enough attention. I don't think we paid enough attention to social, emotional, behavioral impact. And we'll get into that as well. But I thought before we get into the work that I was so blessed to be a part of, and to help lead with a number of amazing people, we should know what's happened. Like what has really happened based upon before and after the pandemic. So I'm going to show you data from the National Report Card. The beauty about, I was telling Cynthia and team before, one of the beauties about doing a presentation like this is, you got to learn, right? You got to make sure you understand. And I got to delve into some things I hadn't looked at. And I have to thank a lot of the great people that I work with who help me every day, Sydney and Summer Reyes, who definitely were, when I was talking to them about it and about this, and they were making sure that I was on point and getting the right thing. So guys, I hope I get this right. I know you'll tell me, so you better. So here's a National Report Card. This is actually federally mandated by the Congress to assess the educational achievement every 2 years in grade 4, 8, and 12. I'm just going to show you some data on reading and math and then kind of give you an overall kind of conclusions that have been reported. This came out in October of 2022, so this is fairly recent. As you can see on the left, you have reading and looking at grade 4, starting from 1992. Yes, that's when I graduated from high school, by the way, guys. Yes, to now 2022, 30 years later. You can see we're at the same level in reading now for grade 4. Grade 8, same deal, the same. But we have lost from pre-pandemic, significantly lost, statistically significantly lost in reading by 3 points. In math, it's been more, 5 points for grade 4, 8 points for grade 8. Now, this is everybody. This is taking everybody assessed, and that includes private schools, public schools, tribal schools. This is supposed to be a good representation of the U.S. Let's just focus on 4th grade reading. And my goal of the next 2-3 slides is to really show you the differences when it comes to race ethnicity regarding the assessment. So you can see here on the top is that overall look. On the bottom, I'm just showing you black and white. So on the left side of the figure is overall black. That includes everybody. On the right figure, you have the top line being the 25th percentile, or excuse me, the 75th percentile. So those who score in the 75th percentile. And on the bottom, you have those who have been scoring in the 25th percentile. And as you can see, number 1, for black children, 4th grade reading dropped by 5 points. For whites, it dropped by 3. If we look at those learners who are on the lower ends of educational achievement, their percentage drop was even greater. It was 8 for black. For white, it was 2 for the upper and 5 for the lower. It mattered. And if we look at a number of race ethnicities, you can see that American Indian, Alaska Native overall dropped 7 points. If we then shifted over to the right, for Hispanics, you see a similar notion that the drop is more. The other thing that I should point out is the starting points, right? If we just look at the starting points, they are less for black, Hispanic than whites. There is this disparity in educational achievement already present prior, and the gap only is growing more from the pandemic when it comes to reading. If we look at the same setup for math, the changes are even more so. Black dropped by 7 in 4th grade math. If you're in the 75th percentile, the achievement dropped by 6 points. If you're in the lower achievement group, you're at 9, and so on and so forth, a greater drop than the white population. If I then pull up the rest of them, American Indian, Alaska Native, Hispanic, you do see the same, except for certain groups, not as much. This is one part of the construct, right? This is that social construct of race. And again, this is where I thank Sydney and Summer for the conversation just the other day about, Jason, don't just focus on race, right? Race is a social construct. I was in a meeting not an hour ago where a wonderful woman from Vanderbilt was talking about, don't forget it's a social construct, and there's other factors that social determinants helps. Insurance, income. disabilities, English learners. And what this report card showed was, while the results varied across the states, that the largest drops were in these, as well as in areas with the longest in remote. But the gaps widened even greater, and that included for low-income families, students with disabilities, and English learners. During the pandemic, you can imagine in these groups, education is harder. And I'm sure many of you out there can give numerous reasons, numerous experiences, and can tell me better than I understand. And this is what I hope to continue to understand. Now, the beauty about, again, working with some wonderful people is, some are sitting come and say, Jason, we found this paper that you got to look at, and that's the impact of poverty. And I wanted to make sure we address this. So this is a journal, Reading and Writing, that was published again here, August of 2022. So I'm going to try to kind of walk you through this as a non-educational researcher. But look, basically they have achievement scores and they standardize them. So 0 means we're all on the same playing field. If you're in the higher standardized mean, that means you're scoring better than others. This open circle is 2019 data. This arrow shows to where it dropped to at 2021 data, right? So we're comparing 2019 to 2021. They used MAP scores. Low poverty was not based on the individual level. It was based on the school level, and it looked at free or reduced lunch eligibility. So less than 25% puts you in a low poverty school. High poverty school is greater than 75%. And I think the figure speaks for itself. One, achievement or standardized scores are less if you're in a high poverty school. And the decline from the pandemic or after the pandemic, whether it's from or after, we can discuss and debate, was more. And they would say also more in the younger age groups than those that were tested 3rd through 8th grade. Now, again, this is high poverty, low poverty for any race, ethnicity. And I think these authors did a fantastic job of then including that impact of race, ethnicity, and poverty together. And we have it here, that performance relative from the Asian, white, American Indian, Hispanic, Black. If you are in a low poverty school, you automatically are above. You're scoring better, though the disparity in achievement is still less. I'm trying to get rid of this thing. Sorry, if anybody knows, Sarah, do you know how I might get rid of this part? Anybody know that's in the way?
Jason, I just see which part is in the way.
Oh, so you're not seeing the share part. Perfect. As long as you're seeing the full slide and not having this in the way of the slides, that's great. Sorry. So I will then say that if we look at high poverty schools, again, the same thing is present, right? That the achievement is less at high poverty schools, and that decline following the pandemic is also greater, and you'll see it even greatest in the younger age groups. And the authors looked in the explanations for these differences, and one is the remote learning contributed to worse outcomes than in-person learning. Now, I think it's important that not all remote learning has been bad, right? Remote learning has allowed many to stay home. I mean, look, today in St. Louis, if you're in St. Louis, it's a snow day, right? I mean, the roads this morning were atrocious. Like, we all can be home. We didn't have to cancel this presentation because we were going in person. We have this. This is a remote learning environment. We can do that. But if you're in a high poverty school and you're in a low wage worker home, and you have to work, as we saw, essential workers, and those who are in, our Black and brown communities are more in the essential. We're more in the essential workers having to be there, and if they're not there, they lose their jobs and don't have their wages. You don't have the person helping the 1st or 2nd grader that's struggling with online learning when you never have done it before. I mean, I didn't even understand how it worked. I was just thankful that, we had everything we needed for our kids. They'd wake up, roll over, have their computers, and they would get on and do it. And then I could ask them how it was going. If you don't have those means and you can't do that, how does that work? And you can imagine for the youngest students, it might be in a greater impact. Though I heard a number of stories where some of the older students says, look, I got to help my family work. I got to go. Maybe I'm not going to be doing this education. I'm going to go out and get, help and get a job, because likely they had a loved one that they lost to this virus. So there was a lot of reasons that we see this decline. Now, I would say that I do think that lack of in-person learning has made a difference. I'm not sure, and I'm not going to ever say it's all the difference, but it definitely impacted. And if we look at those, and this is a CDC paper that came out in July of 2021, looking at that 2021 year, it gives you different figures of access to full-time in-person learning, access to hybrid learning, and access to virtual only learning. The solid blue line is white non-Hispanic. The hatched line is Black non-Hispanic, and then this little dotted line is Hispanic, and then all other races. And you can see that throughout, the white individuals usually had access earlier to full-time in-person learning, as well as access. They were also getting access to virtual only learning. They'll all had that. Access to hybrid learning happened first for white individuals. So that access happened. And even in certain parts of the country, that access was different. In the Northeast, that they were virtual more. And I think that's in lies some of the, questions is how much remote learning is too much? How much remote learning needs to be there? And is there a point where that educational loss is too great? Or is there a point where if a kid's on remote learning and they're now on their phones all the time because they don't have the same accountability, then now they're lost to some of the engagement that might be present at school. And I think that's some of the challenges that schools are facing now. That I spoke to a wonderful friend and administrator who just really told me about kind of and we'll get into that later. So with this backdrop, this notion of remote learning and trying to have in-person learning, which felt like the best place, because in-person learning, not only do you have the learning, but you have the social support. You have the place where teachers and staff members, they identify those kids who are neglected, maybe those who are unhoused, those who need some extra help to provide what was needed, so that they could learn, so they could have some of the things that they normally didn't have at home. And I'm really blessed and lucky to work with amazing groups of people. And I'm going to try to go through a lot of them. And there's a lot of you out there that have helped tremendously. And I want to highlight Dr. Rachel Orslin, who's another Peds ID doc who is an unsung hero in so many ways and doesn't get enough credit for the work that she did, helping schools, especially the local schools, with Education Plus and these local school districts, providing expert insight and thoughts along with our public health departments about can we have our kids in school and do it safely. And she, early in October of 2020, kind of writes up this proposal and says, Jason, I don't know research, man, you're gonna have to do this. And her husband, Nadeem, were like, hey, let's work it through. And we put this proposal together and we talked with the CDC, and lo and behold, before we know it, we're working with the CDC to try to investigate, can school be safe if we have our mitigation strategies in place? Could we do face coverings, physical distancing? Could we look at quarantine policies where maybe some could stay if they were masked and in contact? And we did this work in this early December 2020. I still can't believe it's 3 years ago. And we drove around town picking up specimens, and we had the CDC folks join us. And if you've ever seen me, and I don't have it in the background, but I have a unicorn named Spitz who the CDC gave us to remind us of this work. And what we learned was, I thought, pretty important and was published in 2021. And on the left, what you're going to see is basically what we did is we identified cases in the schools. And again, they were local schools here, and then a local school district in Springfield. We did intentionally make sure it wasn't just West County white predominant schools. We tried to make sure that we were being diverse so that we understood it. Was there something different? Were we going to see more transmission? And hopefully you can see we did okay. The contacts were about 20% Black, 8% of the cases. So I think there's more work to do there. But that was helpful because we had some of that trust to do because we had such amazing community partners. But what we found was transmission in school was rare if you did these things. Our both transmission events at this time, this is before Omicron, this is before some of the craziness we'll talk about later, but only 27% of schools at that time had even greater than 6 feet, and we weren't seeing transmission. This is where we were like, well, we can make school it was more able, that these school administrators who are working so hard and these school staff members who, look, it was hard, right? We didn't know a lot. And you can imagine being scared that we could do this. And when we had the modified quarantine, if you remember that time, or if you had a mask next to somebody who had a case and they were masked, we said, look, could they stay in school? And we found they could. And so this was our first foray into looking at transmission and saying, hey, look, I think we could have more in-person school. It seems like that's the best place. And along the same time, and I could spend another hour on this project, but I have to give credit to this project. And this was done with one of my great colleagues, Dr. Chris Gurnett. She is a neurologist, and so a pediatric neurologist and a pediatric infectious disease doctor coming together to do a COVID-19 testing in schools for those kids with intellectual and developmental disability, which I just told you had some of the greatest drops in achievement scores, because these kids are also marginalized, and these kids were also at greatest risk of bad disease, but also these schools, like, we are so blessed in St. Louis to have the special school district. They serve and help these young individuals, these families, because they get their therapies. And we not only is the special school district in our public schools in St. Louis County, but we also have the actual schools dedicated to children with intellectual and developmental disability. And here's the team, that part of the team that is big. And Tyler Walsh came into the office in October 2020, said, I don't know how we're going to do this, but we need to start weekly testing. And this project went on for 72 weeks. I think did over 20,000 tests, and was a remarkable foray into the next work that I'm very excited to share with you all. So again, let's talk about, our North County schools in this next project. So this work was, as was the work with the special school district, is sponsored by a project out of the NIH called RADx-UP, Rapid Accelerating Diagnostics for Underserved Populations. And also sponsored through the NICHD, the National Institute of Child Health and Human Development. This work we got presented in front of us in February of 2020 as a possibility to apply for this funding. As you can see, I gave you some history that we had been part of this. And so I turned to some friends, and one of them is this group of people. And so all of these people have made a huge difference. I want to highlight a few really. First, obviously, Miss Cynthia Williams and Nancy Miller. Nancy and Charlene were part of that special school district project. And we saw this and Nancy and says, well, we need to talk to Cynthia, because see what Cynthia says. And this idea was that, we thought we could have kids in school, and we didn't think you had to have weekly testing all the time and still be safe. But the CDC was still recommending that. So a lot of schools were staying out. Like, look, we can't do this testing. I'd also say, and it would be wrong of me not to mention, that access is a problem. Access is still a problem. And access for testing at that point in time, many of you know, was extremely difficult. And it was more difficult for those in underserved populations or in our marginalized communities, finding a place to get it, finding the right information of when you should get tested, how you should be tested, how you should quarantine, when you should quarantine. All of these things were present. And so, Nancy, we were talking about this. Well, why don't we look at testing in schools? And we had formed some partnerships with the wonderful school district of University City with Dr. Sharonica Harden, who's just absolutely amazing. It was all in to try to help make sure, our U City, and it's key, right? Our U City community was, trying to do whatever it could to be safe for our families, but maximize the educational benefit for the students. And to watch her manage that and watch the others, Joe Davis, Dr. Joe Davis, Dr. Paula Knight, Dr. Tim from Pattonville, Picaro, it was remarkable to see that. But these folks, Sharita Butler Barnes, Kelly Harris, Sarah Malone, Cynthia Williams, were right there in the first. And I'll say that the idea that we had was that we were going to build a team that was diverse, that was going to go into these schools and be in our schools and be in our community. And there was a day in February where we were writing the proposal, and I was ready to quit because I was like, there's no way we can do this. I can't do this. And Cynthia, who I just met, and Sharita, who I just met, and Nancy, who I had known because our daughters are friends, said, you can do this. You have to do this. We believe in you. We believe in this. We believe in this mission. We believe in the goals of this work. And Kelly, who I just met too, was, implementation scientist and was in there. I was like, yeah, I think we definitely should do this. And Sarah's up there because Sarah was getting her PhD and pretty much dropped whatever she was doing so she could help make sure that the data and the thinking would happen. And then the people on the bottom row. So Albert Lai was part of the REDCap. Julie Nidich led the lab. And if you know that getting this notion of having a data system and then the lab to work together for this research project worked. And then my good friend and colleague, Stephanie Fritz, who's taught me so much about research and home-based therapy and being out there. And then Esther Liu, our statistician, being right there. And Charlene, who in messaging, providing that opportunity. So these wonderful people believed and supported and said, we got to do this. And that is part of, I think, one of the best stories, and will always mean so much to me that they trusted in this and made a team. So what was the project, right? Like, so here I have this, this amazing group of people, and there's more. And it was like, okay, I really want to understand COVID-19 testing in these schools. And I'll show you the 5 school districts that said, hey, we'll do this. But we wanted to say, well, do you have to do this weekly testing to prevent COVID-19 transmission? But also important to us was to understand our community, to work with our community, to be hand in hand with our community, to better understand testing, vaccination, in-person school. And so here's a picture of one of the schools. This is maybe some of you know that school, but here's Summer and Sydney, and Mason, one of our summer students, Summer and Sydney, who were work study students with me before the pandemic, and then joined on as coordinators, and who led how to set up the weekly screening testing in 8 middle and high schools across 5 school districts. Really showed what young people with passion and energy can do, and if we trust them, they will do remarkable things. So here was the schematic, and on the right here you see this is Samantha Hayes, Sam Hayes. I got the real lucky pleasure to work with the CDC work. We got put into contact to St. Louis University, where she was getting her MPA. She was leading our call center. And the one thing about Sam is that, she's always happy. She's always thoughtful. And she put together, this is her schematic of how we were going to do this. And yeah, there was a lot going on here, right? We were going to make sure that number one here on the left side of the screen is that you have the community drive up COVID testing. Access is a problem. We want to make access not a problem for all of our school districts. If you wanted a saliva COVID test, you call us. We're going to have sites that you can go to. We're going to get you tested. But we also wanted to make sure that we really provide some testing in schools on a weekly basis and see who would participate, and could that reduce transmission. Now, we had this idea, maybe we could get the positive cases like our CDC project and then get the context. Well, that became a little cumbersome, so we didn't really ever do the middle. But people like Sam, who ended up taking the lead on how to put all of this together, demonstrated how, again, those who have passion, belief, understanding, and want to improve our community can do amazing things when we do this together. And so we got this great group of schools, and many of you out there maybe know these schools, and if you haven't had a chance to learn and be a part of them, you should, and you should do everything you can to be a part of what they do for these amazing young people in our community. So Jennings, Ferguson, Florissant, Normandy, Pattonville, and U City, they came on during a really hard time, and they put up with me and asking questions and being present and wanting to help in any way possible, but also understanding that, look, I'm not in their community, though I am a part of our community and how we work together. And then thanks to Cynthia and so many others, we had engagement from community partners, and it was key that we worked with folks. Power was on in our first year, helping us disseminate information. Better Family Life, who we had summer students this past summer who went out and presented to our Better Family Life community on COVID-19 and education. And now I have a really good friend, Byron, who I have dinner with on a frequent basis to talk about life and how we can make things better for our community. Beyond Housing, I can't say enough about Chris Kramer and his crew. And they hosted our students and have hosted people to take them around our Beyond Housing Normandy footprint so we can understand our community and what we can do better. And then People's Health Center, amazing, and Care STL, where they're providing care at the front line. Ms. Ross, who was out on testing with Brittany and Christina every week to provide extra resources to those who came to testing so that they might know how they could be cared for, was important. And it was important for us that we had that engagement, that we weren't going to come into our community and take from our community because we are researchers. We were coming into our school community to make our school community better, and we wanted to provide that as we were trying to learn. And that is such an important part of what this work was. And I don't know why I'm this lucky, but here are many pictures of the team. And like I said before, key to this work was that we put together a team that frankly wasn't me, right? It couldn't be a bunch of Jason Newlands. A bunch of Jason Newlands wasn't gonna work, because our community and the people working in our community to reflect our community. And while I want to be there, and I was there at times, relatability is hard sometimes. And I understand, and these young people and these wonderful individuals did that. So, we have Sam, Summer, Sydney, Christina, Tremaine, Brittany, Jasmine, Suese, all across. And then here, one of my favorites, Dr. Mike Peoples, the principal of U City. Here we are at, up at McClure. Here's the team out at a testing site. I believe that's probably Pattonville in the cold. You see, we get dressed up in grad students. And, I'd say that Brock Montgomery, this young man here, who was an educator who joined the team prior to us getting this award and really was an inspiration to how things flowed. He's the one that actually convinced Brittany she should come work. And Brittany convinced Christina to come work. And Sam knew Ashley and had Tremaine come work, and Jasmine came on board, and of course Summer and Sydney had always been here and knew my craziness, and these are the people that made it. And Brock was like, Brittany and Christina should lead drive-up testing and they'll make it better, and Summer and Sydney should lead the screening testing, and I'm like, okay, you got it, man, let's go. And they made it happen. And I'm going to show you some staggering numbers that you trust in your people and you trust in those who have passion and believe great things happen. But I think one of the most important lessons was from Dr. Sharita Butler Barnes. I never understood, right? We talk about all these things, and I remember I would hear about, vaccination rates as they came out, and they would say, oh, Black individuals are only vaccinated at X%. And there's this whole victimization, and it felt, and Sharita taught me, like, dude, that's wrong, right? We need to go from a strength-based approach. We need to promote our strengths within our community. Believe and show, and not make these comparisons that lead to victimization and answers that make us think that we're better. No, we have to promote what's best in our communities, in our Black communities, in our brown communities, and utilize that to uplift and address and make school better for our communities. And again, this looks at asset-driven support system, racial and cultural lens, intersectionality, and empowering, not empowering people so that it's better. And I'm still learning, and Sharita's still teaching me. But I watched her, we got to participate in a panel in Chicago together. And I mean, she opened everybody's eyes. And I know she's speaking next week, and I'm telling you, dude, it'll be amazing. I can't wait. And I think important to that was that we had a community advisory board. And these wonderful from women, Liz, Ashley, Maisha, Hannah, all had a part in making sure we have a monthly meeting of the community advisory board. And at first, I'll tell you, I didn't think I was going to do it. I was like, I'm not going to do the community advisory board. I'll let them talk, but I don't miss a single one. It's the highlight of my month because we hear from our community. We're with our students, our staff, our administrators, our parents. They tell us, they look at our data. I give them updates on COVID. They ask questions. It became clear that, right, the information is hard to get out. If I could provide that to them, we were. So now let's talk about results. I know I'm going to have to go a little quicker, but here are the results. So 2,500 people got tested in if they had symptoms. Over 9,000 tests were done in this weekly screening across 8 schools. If you just look, and I'm not showing each school, but we had the smaller schools didn't provide as much of the tests. Larger schools did more, but that's how the breakdown was. We had 344 positives from May 15, 2021 to June 1st. And this is one of our slides we always show. On the y-axis, here is the number of tests done per week. If you're in this kind of red salmon color, it's those who come for a symptomatic test. If you're in the blue, you're a screener, meaning you got weekly tested. And I can tell you that you'll see the red goes away right here. This is Omicron. And I was really blessed that I had a great colleague, Stephanie Fritz, who spent a lot of time with me when we were calling all the positives during the Omicron wave. We believed that if you were positive, you got a call from a doc, though some of my coordinators helped call too and provided information, because at this time, we were starting to get treatments. If you're at a high risk, you could get a monoclonal antibody. We want to provide that information so that those people who are being a part of us, being a part of our project, would have that access. Access is a problem. We have to figure that out. Now, if we look at demographics, we have some interesting findings. So on the left, you have symptomatic drive-up testing, and on the left pie diagram, you'll see white made up 32% of this drive-up symptomatic testing. Blue is Black, so 56%. Now, if I flip over to weekly screening testing, these people who are getting tested every week, it flips. White individuals were more likely to do screening testing than Black. And so a lot of conversations, a lot more learning we have to do to understand that. And many of you probably have ideas. We also had some great work done by graduate students led by Tyler Walsh, who is an MPH, who's done amazing with the data and setting things up. But we looked at, well, are we actually testing those in higher social vulnerability index areas? So we looked at the zip codes, and Nadie is the wonderful graduate student who put this together. And you'll see that, 58% were in moderate to high, 18% in high zip codes of social vulnerability index. So, and that's among about 2,100 participants. So yeah, it does appear that such. If we then look at results of our vaccination rates in our symptomatic drive-up testing, it started out much less and then changed over time. We didn't ask this question early on. That was my fault. I don't know what I was thinking. But you can see here that 56% were yes, but if you're in the weekly screening testing, 88% were vaccinated. Now, this is just primary series. There's a lot more now with up-to-date and if you kept up-to-date with vaccination. If we then look at just rates, positivity rates, we followed suit with the county, which is represented in red. Our study is in blue, and you can see this is that positivity rate of Omicron. And we had to stop doing symptomatic testing during that time because it was just so overwhelming to all of us. And the lab was amazing. The lab managers were Lauren and Chris were unbelievable. Julie, unbelievable. All nights working to make sure we call people. But you can see that 344 positives, 49% Black, though 60% of our tests overall were in white individuals. So there was a disparity. And if we go to the final outcome or that final, my question, right? This question of does weekly screening testing matter? Well, here's a figure, the weekly positivity rate. Green was those schools where we offered weekly screening testing. Red was those who didn't. There isn't really a difference. And I can tell you participation rate at its maximum at any school was really only 10%. And so there was a lot of, I think, hard and stuff to learn from that doing a research project has a lot of barriers and challenges that, frankly, I don't blame people for not necessarily wanting to be a part of, especially if you're living day to day, and especially if this virus is going to stop you from being able to go to work if you get a test and you're positive. Though, on the flip side, protection of others is definitely one thing. And there's a lot of more work. So now I'm going to shift gears in the next 5 minutes. I know I'm going to go a little over, Cynthia. I'm going to go another 5 minutes here. Social, emotional, and behavioral impact. It's been tremendous, and I probably should spend another hour on this, but we know the childhood mental health crisis was present prior to the pandemic. It was only exacerbated by the pandemic. Talk to any pediatric emergency department clinician, and they will tell you it is overwhelming. I think an important stat that came from work done by our evaluation center, or at least from publications, that youth gun-related suicides and homicides have increased, adding an additional death per day compared to pre-pandemic times. And in talking with school people, the increased behavioral and academic issues are overwhelming. The motivation and engagement for some is lacking. And the increased level of anxiety, stress, and burnout for our school staff has led to a mass exodus of educators to where our schools are doing whatever they can to even provide that in-person learning. That isn't the same. It's nothing like anybody has seen. And I thank you to those who have helped and taught me this. So we did these listening sessions with a number of groups of people. And just to say that we are blessed to have these wonderful people, Liz Roth, who actually wrote the paper, Liz, and Nicole Block-Doctor, who's now the evaluation center lead after Nancy moved into the provost office, has been amazing support as we move this work forward. But what did we learn? Well, one, that those who did weekly COVID-19 testing or that got tested, it provided them peace of mind. And one of my favorite stories is what this quote is. It says, my friend got tested. She lives with her grandparents, knowing her COVID status was really important. And she didn't participate because I kept forgetting to sign up. It wasn't easy. But on the flip side, some weren't aware. Some were just disinterested in a research study. And we know that's true. And how do you do that better in the future? COVID vaccinations, those who liked it said protect themselves and their community. And I think it's key here that one of the focuses on this quote is access. The vaccine clinics were really good. Several of my students are missing documents, so it was very hard for them to get vaccinated in the community. The school didn't require as much information because the students had paperwork turned in already. So several of my students were able to be successfully vaccinated because it was at our school, centered to community, school, centered to where we can provide best health, school, where we provide this education for people so that they can thrive and live. And I see health and school to be such an overlap. But unfortunately, we know COVID vaccines had mistrust and that there's concerns of side effects. There's needle phobia. What about school and district policies? Well, Key to that was clear, open communication. One of our great administrators says, hindsight's always 20/20, but you make the best decisions you can based on the information you have. Mind you, it was always changing. And try to just be as open and as honest with your community as possible. And people seem to understand that, respect that if they think you're just being honest. Man, right? Let's say that to everybody. Be honest. Be honest. Be truly, genuinely honest. But challenges, many asked for more communication. The policies were changing. It was confusion. If we get into the last two, which I think is so important, is our successes when it comes to academics was students really like to be in person. It was great that schools provided electronic learning devices, and the supports provided by the dedicated staff to help their learners is overwhelming, and doesn't get the credit it deserves. But there's challenges. This in-person socialization, the staff shortages, the student apathy. And I heard that more and more even today, where there's this low level of engagement now that we're back. That the phone seems to rule. As one said, self-worth is tied to a click because of the phone and the social media. And here's a parent who said, with them being out of school those last few years, she had a lot of social catching up to do. Started to become a problem because it was just so much talking, wanting to be around friends. It really took away from focus of instructional time in her schoolwork. And then finally, social, emotional, and behavioral impact. Teachers have incorporated that. They had more social workers, but they need more health services. Unfortunately, we have to train teachers on the addressing of altercations and anti-bullying. And one parent said, look, my son's school had 37 fights by week 3. A security guard had his arm in a brace. Another had his leg in a brace due to breaking up fights. Once there were 3 fights at the same time in the same hallway. That's what the reality is. And we're lucky that we're doing more work. Kelly Harris and Tamira are looking at how we implemented this program and making sure we can understand how we could do better. This is one of my favorites. So Brittany, Christina, Cynthia, Sharita are working on empowerment because the NIH wants us to collect data the same across these projects. So we have what we call the common data element questions. We want to know what our community thinks about those. And that's what we're working on, is how does our community think about the questions we are meant to ask you so that we can learn and have research be the same across projects. And lastly, we're doing a vaccine uptake trial because we know that COVID-19 vaccine hasn't been done. And not to belabor this flow chart, but Summer and Sydney Reyes have been leaders teaching motivational interviewing to our team so that the people that are going to get randomized, they either get a motivational interview with one of these wonderful people, including our team, or they get a computer link that takes them to videos. And this work, I think, is the next, is that how do we do more increased COVID-19 vaccine? And I think part of that's going to be access. And so lastly, to end, I have my own reflections. This is my dog, Frankie, him and his buddy, Lamb Chop. I've been thinking a lot over the last two days and week really on how to do this. I am honored, humbled to be the first speaker, scared, nervous that, what this would mean. But I can tell you, as I think through what I've seen and been a part of, and there's so many more stories to tell and what we learned, access is a problem. Access led to problems for our team, in testing. It led to overwhelming stress. And that's only us trying to provide a service. And I can't imagine for the people that just want access, whether at the time of COVID was, getting vaccinated or was it getting a test. The fact a family of 4 can't go to one place to get all their vaccines because, if you have a 1-year-old, the pharmacy is not going to give it because they're too little. The second point is, look, if you think about social emotional behavior, we don't talk about it enough. We talk about this pandemic of a virus, but we haven't, and though we continue, we only talk about, the children are having more mental health. Well, it's not just children, it's the adults. And some would suggest in this oppressor, against our oppressor, social media is becoming one. There are maybe some benefits, but if you're mesmerized by TikToks and you're mesmerized by taking the next video, or you're mesmerized by trying to be the next influencer and missing out on the engagement that school or engagement that athletics or band or drama can provide at being at school, I would argue it's definitely an oppressor if it's taking away from those amazing experiences. And then I'll say that, man, what an amazing journey. And that the team and that our team and these young people that led these teams, because I just sat back and said, you guys go, and yeah, if you have something, I'll help. And they'll tell you that's probably what happened most of the time. They did this and they reflected our community, and our community trusted them. As a matter of fact, today, one of the middle schools wanted our team, not me. They specifically say, Jason, you're not allowed to come. They wanted our coordinators to come present to 7th graders. What's your story, right? They're going to see Summer and Sydney Reyes. They're going to see Christina. They're going to see Brittany. They've seen these people that look like them. They're like, I can do that. I can be one of them. I can be a doctor. I can be a nurse. I can be a healthcare provider. I can do all this stuff. That's what we need, right? And I can't say enough about trusting them. And the partnerships we developed is key. And I have learned tremendously. And I will look forward to continue to learn from all of you as we work forward and move forward to address the disparities, not only in education, but in health as well. So here's the team. I mean, this is only part of them. There's so many more, but this is Brittany had her first baby in December. Chadwick, it's great to have them together. This is them, right? This is all the crew: Anna and Jamie, Tremaine, Sam, Christina, Kelly, Megan, Roz, and Hamza. Like, this is the group that really has made the world work. And I'd say that I don't think you can end a talk like this without talking about John Lewis. And I feel like I missed out because I should have known about him a long time ago. John Lewis passed away in July of 2020. And prior to his passing, he had written this, and it was published on July 17th after his passing in New York Times. It's an amazing letter. And we should all read it probably every day. But he said in this, he said, "So I say to you, walk with the wind, brothers and sisters, and let the spirit of peace and the power of everlasting love be your guide." And I think that's what we have to do. And if we can do that, we'll make a big difference for not only ourselves, but for the young people and for the communities that we serve. So thank you.
Thank you, Jason, for this wonderful, enthusiastic presentation today. And it has been my privilege to get to know you and the team. The first question I want to ask you about is, we hear a lot about a lot of fatigue, COVID fatigue included. So why is it important, Jason, to continue to tell the story about healthcare disparities, despite the fatigue that people have around the topic?
Well, Cynthia, thank you for that. I mean, as I went to put this together, and you see that slide, right? If I go back to that slide of the disparities in death, just look at death.
Yeah.
Our friends that are Black, our friends that are brown, they're dying more. That just shouldn't be. And that's not, yes, they're Black, but that's the social contract, because there's so many things that have put them in this place. The disparities, the racism that has put people in that place. If that doesn't motivate us, we have a problem, right? You can't be fatigued. It doesn't fatigue me. Now I look at that, I'm like, let's go run through some walls, right? Because we can't stop. And that's also with education. And the challenges are enormous. They're mountains, they're Everest. But I don't know. The climb is part of the journey, and part of that journey leads to some of the most amazing breakthroughs and amazing people. And frankly, Cynthia, I think the people that are going to save us, they're the young people, right? They're Brittany, they're Sydney, they're Summer, they're Anna, they're Jamie, they're Hamza, they're those are the guys that are. And so if we provide for them and teach them and be there with them and let them come up and lead, we're going to get there. Going to be some time? Yeah, but it better be on the front. And I, as the white privileged male who has everything, who walks into the hospital, by the way, I don't usually wear a tie, but if I walk in the hospital today, right, I'm the professor, I'm the doctor, I get treated that way. That has to be different for us to get the health disparities gone. It shouldn't matter if Sam Hayes walks in as the doctor or Sydney Reyes walks in as the doctor, and they don't have to wear the white coat, because it doesn't matter. You're going to be considered a doctor, but you've got to wear a white coat if you're a Black woman, or if you're even a white woman. That shouldn't be. Because when you have to have something of physical nature to distinguish whether you are something or not, and not that you're just a part of our community that can help, we have a lot of work to do.
Jason, the next question is, and then I'll go to the chat. I think we'll have a little bit more time.
Okay, sorry.
No. You started talking about, and you mentioned again your privilege. But I saw a transformation with your team and you. We went from the community to our community.
Yeah.
Can you talk about that transformation?
Yes, ma'am. So, you obviously you were a part of this, right? You and Sharita and the team, right? We said our language was going to matter at all times. Our language has to matter at all times. That's why our language to say Tuskegee study is wrong. Language has to be our community. It has to be the United States Public Health Service untreated syphilis study at Tuskegee. Tuskegee had nothing to do with it, right? Just like in this work, our community. I'm not some privileged guy that lives in Kirkwood that I go over to U City, or I go up to Normandy, or I go over to Jennings, or I go up to, and that's not my community. That's crap. Excuse my language. So that was a huge part of the transformation, was we were going to be authentic. And part of that authenticity, you taught me this, right? You and Sharita pulls me and says, Jason, just be yourself. Be the passion and genuine person. Don't be the researcher. Be authentic. And part of that authenticity was going to be we are St. Louis, and our St. Louis is all of our community. St. Louis City is our community. East St. Louis is our community. This is our community, and we want to make our community better. As Sarah said at the beginning, St. Louis has been in the forefront of leading against the oppression, being the resistance. In order to do that effectively, you got to do it as a team, and part of that team is saying our. And that was has been one of the most powerful things. And I get mad at myself if I slip and I say your. I'm like, I have to stop, and I'll have to stop. And I think we have to do more of that.
Thank you, Jason. And unfortunately, we had outstanding questions in the chat, but we are obligated to end at this moment. Sarah, I'm going to let you come in and have your closing remarks. But Jason, thank you so much. And I'll see you at our next meeting.
Thank you, Cynthia. Thank you, everybody.
Yeah, thank you, Jason, and thank you, Cynthia, for this amazing program. A very quick reminder that a recording of today's program will be shared on our YouTube channel, probably in about 2 days, and you can view that as well as all of our past open classrooms there. And we hope that you will join us for our next Open Classroom Black History Month program a week from today. That is Wednesday, February 1st, with Dr. Sharita Butler Barnes. She will be speaking on Give Me Strength, Race-Related Stress, Parenting Practices, and Socialization Messages of Black Parents. So we hope to see you for a future program. Thank you again, Jason and Cynthia, and all of our participants. Have a great rest of your day. Stay safe if you're out there in the snow here in St. Louis. Bye, everyone.